Hi, Dr. Simpson.
Hello, Mr. Ambrose.
And where are you employed?
Western Michigan University.
And what is it you do there?
I'm professor and director of the specialty program in alcohol and drug abuse.
Since that data master has been in the lab at Western Michigan University, how many tests have you conducted using it?
Over 4,000. I'll start again. Our postdocs indicated that the instrument is supposed to register invalid sample anytime mouth alcohol is present. But they, in placing mouth alcohol in certain people's mouths, found out it was actually registering a...
Did I ask you what the exact instructions the officer was supposed to give him?
Well, he's supposed to give him the instructions first that I'm going to demonstrate this to you, what I want you to do, then I want you to do this test. And then he goes through the actual procedure I talked about a minute ago.
Okay. Would taking 8 steps out and 6 steps backwards, does that fall within the NHTSA standards?
No.
Does using a gapped line that's in between the roadway and the curb fall within NHTSA standards?
No.
Not properly instructing a subject, only telling them to, the only instruction they gave them was to walk 8 steps out, 6 steps back. Does that fall within the NHTSA standards?
No.
And so a test performed in this way, what kind of correlation would this have to a person having a 0.08 or higher blood alcohol level?
You could not assign the probabilities of a person, any probability of a person having at or above 0.08 based upon this.
And as far as injuries to a person's legs, would that affect the reliability of this test?
Yes, it's one of the questions you should ask beforehand. If anybody has any extremity injuries, especially the legs, knee, hip, ankle, toes, you wouldn't give the one-leg stand or the walk and turn.
Now, as far as in this case, relating to facts in this case, there's been testimony that Ken Edwards had blood in his mouth prior to him being administered the breath test. How would that affect the results of the test?
If Mr. Edwards had been drinking, and I'm assuming the response to that is yes, then the alcohol would be in the bloodstream, and if blood was emanating to the mouth, it would be in the mouth. It would also be concentrated 2,100 times that of breath, any of alcohol in that amount of blood.
So just to be clear, the blood would be 2,100 times more, more powerful as a reading than a person's breath.
More concentrated, yes, sir.
More concentrated than a person's breath.
Yes, sir, in the blood.
I'm sorry.
In the blood.
Now, does this data master instrument have any apparatus in it that's supposed to detect mouth alcohol?
Yes, it does.
And what is that apparatus?
It's called the slope meter. Actually, it's a term that's used for all infrared breath testing devices. It's called the slope meter, which is built into the BAC data master.
And does blood in a person's mouth that contains alcohol, is that the type of mouth alcohol that this slope meter is supposed to be able to detect?
Yes. Along with any vomitus or belching that would occur, or residual alcohol in the mouth.
And was that one of the reasons why you conducted your study?
Yes. It was based upon mouth alcohol, which could be made up of any of those components.
Which would be blood or blood that contains alcohol.
Blood that contains alcohol, belching, vomitus in the mouth, and or any residual alcohol still in the mouth, still hanging around.
You testified, you said 2,100 to 1.
Yes, is what's built into the BAC data master is the partition ratio.
Okay, and is that actually the partition ratio, though?
No.
What is the actual partition ratio for human beings?
We have done research previously on it. Numerous people have. It's approximately 2,300 to 1 is the actual average. We're talking about averages here. The people vary plus or minus 48% around that 2,300 to 1.
Okay. And as far as, I know you testified this earlier, regarding this, how much, when you did your study that you published, regarding mouth alcohol, the BAC's data master's ability to detect or not detect. What was the range that the mouth alcohol would register in?
When it registered as a number, the minimum was 0.02 and the maximum was 0.43.
And what would, just to give the jury an idea, what level of intoxication would 0.43 correlate to?
At 0.43, 50% of the population would be dead. We're at that level. Because 0.40 is what's known as the LD50, lethal dose for that is lethal dose for 50% of the population. If you're above 0.40, if we had actually 6 jurors instead of 7, 3 of them would be dead. And the rest would be so stuporous as to be non-responsive.
And so, according to the published research, 48% of the time, when there is mouth alcohol, which can be caused from different sources, the machine will actually register a result. Is that correct?
Yes, it would. And in those cases, if there's actually alcohol in the bloodstream, it would add that whatever number to the actual breath alcohol concentration.
And 52% of the time, it would register an invalid sample.
52% of the time, by our research on our subjects, it registered invalid sample.
And how much blood would it take in a person's mouth to, affect the instrument?
It had to be a meaningful amount of blood. It couldn't be microscopic or submicroscopic. It would have to be actual visible blood in their mouth. But you could, if you could really look in there and really take a look, you'd see it someplace. But it'd have to be oozing. It could be oozing blood. It just couldn't be 1/100th of a drop, is what I'm saying. There was one research study, maybe I'm not supposed to say that, but that registered 0.001 for minute quantities, and then you started moving up the line.
Now, when you conducted your study in this, did you check the subject's mouth?
Yes, we did.
Did you check it with a light?
We checked with a laser light. We had their head tilted back. We took gauze, lifted their tongue, looked all around with a laser light in their mouth. There was nothing in their mouth except saliva.
And why did you use a laser light as opposed to a regular flashlight?
Because it gives a better look at a very pinpoint area. It wasn't a laser to burn them, but it gives a very good, you can really see the area inside the oral cavity. We looked all over. This is as good as an inspection you're going to get. We wanted to make sure nothing was in there before we started.
Okay, when you said you used gauze,
we lifted up their tongue. Well, we weren't going to grab their tongue with our bare fingers. We had gloves on too. We put gauze on because it's easier on the person's tongue to be candid than grabbing it with 2 pincer fingers. Lifted their tongue to one side, around, other with the light so we could see it. We just didn't. The only reason we really used gauze, the gloves were sanitary, but we didn't want to really pinch their finger. Give a little cushion on their tongue is the main reason.
and as far now, in this case, you've seen the breath test, is that correct?
I've seen the breath test results, yes.
This registers a sample 0.15 in 2 separate readings.
Yes, it does. At time approximately 3 minutes apart. It shows 3 minutes apart, but it's less than that. It's probably 2.5 minutes that overlap there. It wouldn't go that long.
If there was blood in his mouth, presuming that fact, how could it be explained that both the test results are the same?
If blood would enter in his mouth only on one occasion, you would expect a higher reading on the first test and a lower reading on the second. Meaningful enough for that to require a third test. The way you would explain that, if there's blood, if they're assuming there's continuous blood being emanated into his mouth, you're saying you would need a continuous flow of blood into a person's mouth in order to maintain that level. As simple as that.
When you say flow of blood,
I'm not talking about hemorrhaging out the mouth. Okay. I'm not talking about anything like that. But it'd be a small amount of blood oozing out. Not microscopic by any means, but an amount of blood oozing out in the oral cavity, the mouth.
It's the kind that would come from an open cut inside the mouth that was recently inflicted.